Okay, good evening. Welcome to How to Crush Your EM Rotation. So thank you for coming. My name is Robin Holly. We'll go into this. I want to let you know that during the presentation, there's going to be some slides with lists of several resources, and I'm not going to stop for very long on some of the slides, so feel free to take screenshots, and then we will also be posting this for you guys if you want to go back and read or refer a friend to read it. Okay. Do this. All right, here is the information about Florida College of Mercy physicians and some QR codes to our Medical Student Council page, as well as the FCEP Medical Student Council Instagram for you to get information, announcements, and ways to get in touch with us. There we go. Future sessions include flows explained next week. And then in July, we have strategies for choosing fourth year schedule. Most of the people I think on this call are already there and figuring that out. So we'll get the word out to MS1 and 2s. And if you have any interest, here's some of the other dates. We have registration opportunities on the Instagram. And we're not going to stop very long at this slide, but this is my intro slide from the last one. If you have any questions, happy to answer them. Those are my work kids. That's what my kids call them, my work kids at work, and our residency website, if you are interested. Okay, how to crush your EM rotation. Here's the outline of what we're going to go over. And I'm absolutely happy for anyone to interrupt during so that we can answer questions or clarify anything that you might have a question about. We're going to talk about gathering info, preparing and practicing prior to your rotation, high yield resources and topics that you need to know about and prepare for, and then shift by shift guidelines. So let's get going. So this is a very busy slide, I apologize, but this is about gathering your info, no expectations. So when you get your syllabus from your rotation, they're going to have goals and objectives, and some syllabi are, most syllabi are not clearly written, but some are. This right here is the suggested outline of what a fourth year clerkship should be asking you to either demonstrate, understand, or present. So this is really a generic set of objectives, and you might find specific or special objectives in your syllabus when you get that for your rotation. But this really is what you are trying to accomplish during your rotation. And that we're going to go back to this because this is important. This is what they want from you, and this is a way to put it in doable bite-sized pieces and understand some of what they're going to want. I have the last one, it's pass the 4 a.m. test. If you don't know what that is, the 4 a.m. test is when you are on night shift and it's 4 a.m. and the attending and the resident still are okay with you being in the room, because 4 a.m. is when the frontal lobe shuts down and everybody really shows who they are. And the 4 a.m. is a big, that's what we call it, the 4 a.m. test. It's a big thing that when you can pass the 4 a.m. test, that means that you're still part of the team, you still kept your motivation, your attitude, and your brain is still on. Okay, so we'll come back to these, but I want to give you a chance to look at that. So gather your info. It sounds a little strange, but each rotation, each residency, each hospital, and each clerkship will have a little bit of a different flavor. So gather your info from their website, the rotation syllabus, and past students, anyone who's rotated there before. Some clerkships you will be paired up with a resident and you will be presenting directly to the resident the whole time. Some clerkships you'll be teamed, and then some clerkships like ours, you're paired with an attending. So it's different and it's okay. There's pluses and minuses to everything, and you just have to try to find out what is going to happen in your clerkship. Now, is this critical that you find this out a month before your clerkship starts? Absolutely not. But it would be helpful to know if they have specific rotation expectations. Are you going to be taking 2 flights on a helicopter and I don't know, you have something against helicopters, you don't want to go, you should deal with that now. Are you going to be doing a peds like shift within all your other shifts? Are you going to be doing an ultrasound shift? You should know these so that you can prepare. And then the who's who's going to be supervising you? Who is the residency director? Who's the clerkship director? You need to know who those people are because you're going to be dealing with them on a daily basis, or maybe not daily basis, but at least halfway through your rotation at the end, you need to know who they are. And it might be helpful to know their interests. Is the clerkship director some toxicology nerd and all of his research is in toxicology? That should be good to know. Where is the rotation? I don't mean like what state or city, but is this an inner city population? Is this a population where there's going to be a plethora of geriatric patients? That's going to help you understand how the ED is going to function or what you need to know and prepare for that. And is there going to be a shelf exam or not? And you need to gather that information to help you in the next stage is to prepare. Okay, so prepare and practice. Okay, so to prepare and practice, first of all, I would like to say that I did not do this. I just showed up for every rotation thinking, okay, teach me. That's what I did when I was a medical student. And especially third year, which is okay, you figure it out, but this is going to be your audition rotation. You really don't just show up at ground zero and just expect to learn everything. You really want to prepare. This is like an interview, it's like an audition. And no, you don't have to walk in being like an intern or a PGY2, no, but we can tell when students put in the work and they're motivated and they're interested in performing well and learning, really learning. So this isn't just about impressing your clerkship director. This is about becoming a better, not student, but eventually a resident and then a physician. So this is kind of a stepwise way for you to approach that. So pre-rotation learning, before you ever go to your rotation, there's going to be a bunch of steps. And each one of you are going to have to design your own plan. And we're going to talk about that. You should prepare and practice HPI and presentation. You should absolutely do this. This is not your medicine words. It's not your surgery. This is not ICU. It's different. And we have guidance for that. And then prepare and know your resources. Don't hit the floor and be learning what app to download and how to approach things. Have it all prepared and ready and know your resources. So we're going to talk about that and how to do that. So pre-rotation learning, I've broken this up into, well, we're going to talk about resources, and this slide is to remind me to tell you guys, look at your resources, think about what you need. If you used to be, I don't know, a heart lab technician, like an EKG person, and you watch telly all day and you know every single thing about EKGs, you really should not be devoting any pre-rotation time to studying EKGs, right? If you feel like you've gotten feedback over your third year that your differential diagnoses aren't broad enough, then you are going to really concentrate on that part of your preparation for your ED rotation. So I want you to make a plan and I want you to stick to the plan and preparation. Okay, so pre-rotation learning. There's a lot of resources out there. These are three that I think are absolutely very important and very, very good. ALIUM is academic life in emergency medicine. So when you get on the website, you'll be like, whoa, I'm going to tell you this resource is completely legit. Lim is like an amazing educator. She is absolutely wonderful. She's who started, and now there's just so many amazing EM educators devoted to ALIUM, and they actually have a course. It was originally for residents, so they have a course called Ground ED that's specifically for students. And it started was when everything went virtual, and it was like a 4-week virtual curriculum to add into other experiences. But it's very clear you can, first of all, you can subscribe to the medical student newsletter, which ALIUM would be very helpful. And two, you can sign up for grounded. And basically there's curriculum is separated into 4 weeks, but it tells you like the first week is 8 hours. The second week is another 8 hours, and you do it at your own pace. So it's not, you don't have to do it in 4 weeks. This doesn't have to be a curriculum that you do over one rotation. This could be over the next 2 months because you're going to hit the ER in August or whatever. This could be, you could space that out, but I would very much encourage you to look at that, as it's a curriculum that's supposed to broadly touch on the basics of EM knowledge for a medical student. EMRA fundamentals. When you join EMRA, you get a happy present. It's a box of books that will make your inner nerd so happy, and they're wonderful. I pulled this off my shelf today to reiterate that the EMRA fundamentals, it's called EM fundamentals, is an amazing resource. Now we're talking about pre-rotation learning. So do I want you to read this whole book? Nope, I don't. There's chapters in this book, and I can't remember. There's 16 chapters. They're divided: headache, abdominal pain, trauma, whatever. At the beginning of each chapter, there's 3-page, it's 2 to 4 pages, quick guide. My suggestion to you is to read the first 2 to 4 pages of each chapter, because it's an overview quick guide of these complaint-based presentations: abdominal pain, back pain, trauma, whatever. And it helps you get your head in the game as far as, this is all the different things that can show up, and this is how I'm thinking about them. Then you'll notice, and we'll talk about this a little bit later, but then you'll notice each chapter then breaks it up. So chest pain chapter also has a section for pericarditis, so it's going to break it down into individual complaints, and you're going to want to use this on your shift. But for pre-rotation learning, I want you to read the first 2 to 3 pages in each of the chapters. Okay, the next one is basic EKG in 10 days. So I will admit to you that I've gone back to this book over the years several times. And some of you, this may be too basic. You may be like, I just did an 8-week cardiology rotation and you don't need this. That's totally fine. What this book is, and why I picked this book, is because it really goes back to the basics, and each day has like 10 EKGs to practice your skills on. And I found I found a bunch of used copies for about $5 online. So this book kind of, maybe you've done ortho, you've been out of medicine, you haven't looked at an EKG in a long time. I don't know, but this book, it's simple, it's fast, it goes through the basics. You're not going to get bogged down trying to identify some bizarre zebra Brugada syndrome that doesn't look like every other Brugada syndrome. Like, this is going to get the basics so that you can, at least if an attending hands you an EKG, you know how to go through it and you can sound decent. Okay, pre-rotation learning. All right, bear with me. So the yellow box on the left is basically a list of complaints that patients come in with, right? So in the ED, your patients are undifferentiated. You don't have a patient referred to you because they had a biopsy and we know that they have breast cancer and they need treatment, right? So no, they're coming to you with a complaint: abdominal pain, altered mental status, cardiac arrest, chest pain, GI bleeding, headache, etc. And they're coming to you, and you have to understand what they're saying to you, communicate with all different types of patients, basically get the information from the patient, take a history, do a physical, come up with a differential diagnosis, and then a management plan that helps you go through your differential, cross things off, and highlight other things. So to prepare you for that, you can learn all of EM and do a whole 3-year residency to be prepared for your clerkship, which is ridiculous. Or you can start to understand the idea of these complaints and, in general, how to approach them. So if you go to WikiEM, which a lot of my residents actually use, you can type in abdominal pain and it will give you general approach to abdominal pain. This had the 3-page quick guide to abdominal pain. If you were that student we talked about before who's gotten feedback that their differential diagnoses are not broad enough, for example, or not complete enough, that may be for several different reasons. Maybe you are anchoring, maybe you don't have enough fundamental knowledge. This is a way to beef that up. In the EM fundamentals, it has a list of suggested differential diagnoses in Wiki EM as well. So it gets your head thinking, oh yeah, abdominal pain, old person, abdominal aortic aneurysm has to be on my differential. And if you work through these and you make cards or whatever you do that works for you, you will have this in your mind and you will be ready instead of showing up kind of wet behind the ears and having to put your head into the games there. Okay. So CDR, what does CDR stand for? Clinical Decision Rule. Okay, so pre-rotation, clinical decision rules and tools. These are the things that all of us every day use in the department to help us make management decisions. So this is very important and impressive when a student knows enough about chest pain that they were able to determine that this patient may be a low risk chest pain, which means that they have a low risk for having MACE, which is a major acute coronary event in the next 30 days. And maybe we could use a clinical decision rule to decide whether they get discharged or admitted to the hospital. Now, that's a really higher level, like a little bit down the line from a medical student level of understanding. But it doesn't have to be, because here are the 7 high yield tools and rules that are used in pretty much every department. And those are the rules and tools I want you to go to MD Calc. I'm guessing that you guys have already used that, and it is absolutely amazing. And the reason why it's amazing is I took a little screenshot of PERC, rule for pulmonary embolism. If you've never used this part of it, see the little drop downs, when to use, pearls and pitfalls, and why use. Go to each of these rules, star them so that when you sign into your MD Calc, they're right there for you. And when to use is absolutely important. When to use tells you which population of patients this is actually appropriate to use in. Okay, so for example, heart score. Heart score is used to determine whether someone is low risk chest pain enough to be ruled out in the heart score pathway. And heart score can only really be applied to people who are not in chest pain, who are not having chest pain anymore. So you have to know to whom to apply these rules, but you also look like a superstar when you come up and you say, well, if we're thinking acute coronary syndrome, Mrs. Smith's heart score is 3. And what happens is MD Calc will tell you that means her risk for MACE is, and I think it's 1 to 2%. She can be discharged for follow-up. Pearls and pitfalls as well gives you information of pitfalls of the test, but pitfalls where people misuse the test, and it gives you the evidence behind the test. So if you're supposed to go do a 5-minute presentation on pulmonary emboli, you should probably include the PERC and the Hoelles, and MD Calc has the original papers for you. So I want you to look at MD Calc. I want you to look at these 7 rules and tools and know them for your rotation, okay? All right, pre-rotation, preparation for procedures. There's a wide variability of experience and procedure. Some medical students come to us and they've never even done a rectal. Some medical students come to us and they've put in several lines. So there's a wide variation. These are some very helpful resources for you. The EMRA.org has a skills videos page where they've collected from, like, there's a lot of JAMA, not JAMA, New England Journal of Medicine had a procedures video series. So they've collected all of these for you on this page where the QR code leads to. MRAP.org is emergency medicine. I think I had this problem last time. I can't ever remember what RAP stands for. Anyway, MRAP, you get a free membership to MRAP with your membership to MRA. So MRA allows medical students to sign into MRAP. When you sign into MRAP, you will be a little bit overwhelmed, but I want you to know that the videos have a section called procedures and splainers. And the videos are divided into, I think there's splainers, and then there's, I can't remember what the other one is, and then there's procedures. And they literally have 5 to 7 minute videos on like every EM procedure that you could think of. And they're simplistic, well thought out. You look at your equipment and they're short and sweet. I would very much encourage you. I mean, y'all should know my rant about joining CORD and MRA. They're one and the same. You have to join them to get your books and to get access to MRAP. MRAP also has a series called EM Crunch Time, which are like board study questions that are a little bit, that will be helpful to you when you become a resident, but probably not as helpful at this point. These are the high yield procedures I think you should at least, if you haven't participated in them, I want you to watch a video. I want you to look into, and for every procedure, I want you to know the indications, the contraindications, the complications, and side effects. So the next step would be understanding, which again is not necessarily your level, but the next step would be understanding how to consent a patient for each of the procedures. And again, there's a wide variability. Some of you may be very well versed, but I want you guys to know this, like chest tube placement. If you know how to place a chest tube, so you know the 30-second chest tube and you know the 30-minute chest tube, they're very, very different. Now, tell me why you couldn't just put a pigtail in there. Tell me why it had to be a 32 French. Tell me why can't it be a 14 French? Some of you might be saying, what's a French? Hey, not a problem. Everybody needs to start out somewhere, but here is a place where you can collect the information and become more educated. Okay. Shelf exam prep. I didn't put a lot of procedures up here. There is an Anki for this on Reddit. You guys have been figuring out how to study for shelf exams the whole year, or you will be if you haven't. And you guys probably know what works for you. I will tell you that personally, if I only had so much time, I would devote more. I would want to be in the department more and learning more than studying for my stupid shelf exam. But I will tell you, the shelf exam is an objective number and it's part of your grade. And if you do okay in the department and you do great on your shelf exam, that will really help you. If you do great in the department and great on your shelf exam, that is super great. If you do okay in the department, you don't do well on your shelf exam, they're gonna be like, eh, you know. And if you do great in the department and not great on a shelf exam, you know what I'm saying? It just adds something. It's worth studying for. Okay, so that's pre-rotation learning. And like I said, if you have 2 months to prepare and you write out your schedule, you write out what you want to do, put in the time. If you put in the time for your boards, you pass your boards, right? If you're going to be on ICU for 8 weeks, so you don't have a minute, write out what will work for you and watch one procedure video before you go to bed. Just get your feet wet and stay on schedule. Okay, HPI and presentation practice. So there are some templates available. And these are 3 sites. Well, so the first 2, EMRA. We've talked a lot about EMRA. It's an amazing resource. We've talked about LEM, Academic Life and Emergency Medicine. These are, the EMRA video, I think, is 7 minutes. The LEM thing is like, it walks through what a 3-minute presentation is. And if you really, really, really had your shiznap together, you would review it and you would just practice. Seems cheesy, but just practice. The last QR code is CDMs, which is the clerkship director, emergency medicine clerkship directors. They wrote a guide for you for EM clerkships. It reads like a tome and it's a little out of date. God bless the clerkship directors, don't take any offense. But I would say that there are some valuable like information on how to switch your thinking to EM clerkship thinking. So if you get a chance, this is a QR code to the PDF. Skim chapters 6 through 14, like skim them. You don't have to take notes, you don't have to memorize them, but some of them are about like data gathering. What's important about data gathering in the emergency department? It's very different from your other rotations. So there you go. Okay, so now we're on prepare and know your resources. Okay, EM fundamentals, we've already talked about this. So this is your on-shift resources. This is what you're gonna have with you. This is the little book. It's totally not cool. You actually have a book you have to read. It's not color, whatever happens on the smartphones. I mean, I'm just kidding, I have a smartphone, and I actually use apps. But this book, I don't think it comes in, there's not one on app. And this book, let me tell you how you're gonna use it. You're gonna go to your patient in room 7. You're going to talk to them, their abdominal pain, they're vomiting all over, you get the information, you're feeling smart, you walk out, right outside the room, you're going to turn to abdominal pain. And then you're going to turn to, I really think they have cholecystitis, or you look down the whole differential and you're like, this is what it is. There's a small, like quick reference to everything you need to know about cholecystitis and choledocholithiasis. And it gives you the evaluation, it gives you the management, it gives you the control, it gives you the disposition, it gives you a beware section so you don't mess up. And then you have all that in your head and you walk back to your team and they say, okay, get your presentation ready. And you're like, damn, I'm good. I know all this information, it's all ready. And it was right here. And that's not cheating, that is smart. And then the next time you see someone with abdominal pain, you're going to have that information. You owned that patient, you owned that complaint. And even if you were wrong, which is totally fine, then you're going to have that information in your head, and using it real time with patients is important. Do I want you to stand outside the room for 20 minutes and read every resource you have on that? No, your team will find you and you will be made to shorten that time. Okay, but this is a quick reference and I think it's worth it. All right, EMRA antibiotic guide. The EMRA antibiotic guide is used by, I would have to say 80% of the like current practicing ED physicians. And it is a book that you will get after joining CORD and EMRA. You get it mailed to you. And it is also an app used on the phone. And it is up to date. It is super well written. I was going to pull it up, but having connectivity issues. It is by, you can look at by complaint, you can look by antibiotic, and it is kept very much up to date. So you need the EMRA antibiotic guide. Do not go to your clerkship without it. This is like not even a choice, okay? All right, Wiki EM. Obviously, you're not going to carry it around with you, but you're going to have it on your phone and you're going to think about it because it's another opportunity for a quick reference with differential diagnosis and treatment. And the way they organize their page allows you to be used to that organization. You can quickly skim and see what information you need. It is much more set up for quick reference and EM use than up to date. Okay. All right. MD Calc. We've already talked about MD Calc. I want you guys, whenever you use MD Calc, I want you to look at those subsections of when to use pearls and pitfalls and who to use it on. Okay. You will thank me eventually. That will be important to you. Okay. All right. On-shift resources, ultrasound. Some programs are very ultrasound heavy. We use ultrasound a lot in our program. And if you as a student are in an ED where people want to use ultrasound a lot and you have it available to you, this is the best website. And they do have a app as well, Focus 101. POCUS 101 is fabulous. It's very well organized. It goes back to the basics. It tells you it's not too basic. It tells you background information of why certain findings occur so that you can put it in your head. And then they also have quick reference cards. So if you're on rotation, you're like, I have to do an ocular ultrasound, but I can't remember how many views I should get, et cetera. They have that too. So check it out. Very good resource. All right, so we've talked about gathering info. We've talked about how to prepare and practice, high yield resources and topics, and shift by shift guidelines. Okay. Oh no, now we're on shift by shift guidelines. So sorry. So shift guidelines. I want to let you guys know that I have attended a lot of EM education conferences, and we talk a lot about this. There are a lot of references out there, some of them a little outdated. EMRA puts out information, CORD puts out information, and SAM CDEM puts out information, and all of the guidelines, every single one of them emphasize and start with this tip: be early. Being early is not my superpower. But when you are a resident arriving for your clerkship shift, I cannot say how important this is to be 5 to 10 minutes early to your shift, to get oriented, to be there, be available. And this is very, very important. Arriving late to your shift is a huge mistake that people will not forget. Okay, here's some advice. This is the advice on arrival to your shift. A, we already talked about being early. B, the introduction. So this is really important because everybody needs to know who you are. And by introducing yourself to people, you are telling that person that they're important to you and to you doing a good job on your rotation. It's not like, oh, I'm so important, I'm a medical student. Hi, I'm a medical student. It is, hey, I'm Robin, I'm a medical student rotating, I'm a 4th year. I just want to introduce myself in case you need anything and I can be of help. To the charge nurse, to your team, and Lord have mercy to the clerk. Okay, make friends with the clerk and the charge nurse. And pretty much anyone in the department. You guys probably know this. It's a very team-oriented specialty, and we all rely on each other. So please know that you really need to introduce yourself and who you are, even to the patients. Hello, I'm Robin Hoelle, and I'm a medical student rotating today, etc. Okay, so how to frame your shift. This is going to be a little bit next level. So maybe the first week when you show up to your first EM rotation, you really are just like, you definitely can be early, you got that. You introduced yourself, you got that. But now you know where the bathrooms are, you know where the suture supplies are, you know where the warm blankets for the patients are, etc. Now you're ready for next level stuff. I want you to think about this advice and really think about how you can incorporate this. Framing your shift. Okay, so framing, this is an example of framing your shift. Good morning. Hey, I'm glad I'm working with you today. We had a great shift yesterday. Is there anything specific you want me to work on today? And usually people say no, unless they worked with you yesterday and said, yesterday we talked a lot about making your presentation concise. That's what we're going to work on today. But maybe you haven't worked with them before. And they kind of pause and say no. Then I want you to be prepared with something that you want to work on in that shift. I would like to work on this list on the right: history taking, or presentation skills, or specific procedures, or clinical reasoning, or death telling, or appropriately ordering, or communication with family, or communication with consultants, or wide enough differentials, or interpretation of tests, or EKG interpretation. Now, you may say to me, which is quite reasonable, how do I know what I need to work on? I agree. You probably aren't the biggest expert on knowing what the most important thing for you to work on is. But I'm going to tell you that the way EM education is, by the nature of how we staff our departments, that you may work with the same physician twice or 3 times and maybe not again. So each shift you show up, you may have a new resident, a new physician. And that physician probably is amazing at a lot of things, but maybe being introspective or understanding, not introspective, but understanding you and your educational needs, they probably aren't going to be understanding of that. So you need to take a little bit of control over that and really become self-aware. Like, okay, yesterday I totally missed the mark. I thought they had a URI and they ended up having an ectopic pregnancy. So at the end of your shift yesterday, you talk to your attending, you're like, well, why do you think that happened? And whatever that was, then you can come to the next shift and say, I would like to work on this because I really want to get better at that. And then at the end of your shift, you frame it at the end of the shift, amazing shift, thank you so much. And instead of saying any feedback for me, which everybody asks, and it's kind of like, oh, I don't know, what do you think about it? You can give them something to talk about. Any feedback on my presentation skills today on being more concise. Was I more concise? How do you think I did? And that actually, you are helping your supervisor help you. And I'm telling you, this is next level. You guys, if you can incorporate this in the second half of your clerkship, you are definitely going to be recognized as being on top of it. Okay. Shift guidance, ways that you can help in the ED. And you guys figure this out, and every ED is different, but getting the patient in a gown and monitor is not stepping on somebody else's toes, and it's not beneath you. I help do things too. I have gotten my own urine sample. Well, not my own urine samples, my patient's urine samples for sure. But as a medical student, you actually have the most free time in the department, and you're at a place where you can choose to own the patient even more and help further that care. Calling poison control, the nursing home, or the patient's family, updating the resident attending with critical results, keeping the patients updated, even getting the patients blankets and water if they're not NPO. Don't make that mistake. The ones in orange are really the ones that like just absolutely help out so much. Calling nursing home or family is actually super important to appropriately care for patients, but it is very hard to stop the flow and get that time. And keeping patients updated is one of the most valuable things we can do on a shift, and one of the things that gets hurried a lot. So these are ways to help in the ED. All right, the attitude we're looking for. Like often things that are commented on when we have roundtable discussion about our students and residents for that matter, and what is written on some of the evaluations. So first piece of advice that I am a glass house. Like I can't tell you to stay focused because I have a big problem staying focused, but that is advice given by a lot of really smart people. If you can stay focused, you will do much, much better. Don't let us crazy people get you off track. Okay, be humble and ready to learn from it all. So if a nurse is offering to teach you how to put IV in, Lordy, get them to teach you how to put an IV in. Help around the ED, we're a team. So all those things I listed prior, it's not demeaning or beneath any of us to get someone a blanket, to help put them on the monitor, etc. Own your patients and know the details. So this is something that I really notice, or my faculty really notice and comment to me. When you have a student who owns their patient, they notice the labs first, they know the most current blood pressure, they are the ones that saw the patient last because they re-examined the patient, they know their family members. You own your patient and you know the details. That's very important. You're not there to just superficially see as many patients as you can and I don't know, do as many lacerations. You know, you have to have some depth in that workup. Not ICU depth, but ED depth. Re-examine the patients, move fast. I know that sounds silly, but move fast. Never, this is really important. Never speak badly about patients. We have a tendency with Black humor to make fun of situations, sometimes that erroneously includes patients. Never speak badly about patients, and never speak badly about other programs when you are rotating. It's not good, not a good look at all. Okay, so now we've done shift by shift guidelines. All right, so I blew through a lot of that to try to get them out. We have a little bit of time for questions. I'm going to stop sharing and see if there's any questions I can answer for you guys. Oh, emergency medicine reviews and perspectives. I see. Okay. Perfect. There are some links in the chat to the EKG book and to some of the and to the Google Drive where we're going to be posting this. So Rachel, should we go over any of the questions?
Yeah, if anyone doesn't have any questions right now, we can go to the ones that were submitted on the registration forms.
I have a question.
Mm-hmm.
I'm sorry. I missed the first 20 minutes. I just kind of like got out of the hospital like a little bit and just got home. I feel bad. Thank you so much for like doing this. It's really helpful. Are you going to be able to share the slides too, just so I can kind of look back at the previous slides that I missed?
Yes. So what I will do is we're going to be posting the video, but in that Google Drive, which obviously I haven't done it yet, I'll post like a PDF of the slides so that you can see them.
Okay, cool. Thank you so much.
No problem.
And I guess I do have a question. Hopefully this wasn't answered earlier in your presentation, but so I guess like as far as you kind of had mentioned some things like some ways to be helpful in the ED. What are like some things that you've seen with medical students where they're either like doing too much or like doing too little? Like overstepping, you know, kind of like going outside of boundaries where it's like, hey, I don't know what you do. Like, I'm not comfortable with this, or like, you're really not doing enough.
So I would say that that's a great question because it's sometimes that intangible kind of, it's hard to ask, like, am I doing too much? Am I not doing enough? That is very, very hard to ask. There's also a trap that, for example, we had a resident who would like get her own blood, would get the urine all the time, would hook the thing up, and she really was kind of getting out of her lane. And by getting out of her lane, I don't mean stepping on toes or she's too good to do that, but she would miss out on other opportunities because she was performing nursing jobs that she, you know, so she wasn't seeing more patients. Like it was affecting the flow and her own education. And so I give you that example because if you are standing around because whatever the flow of the patients, your team's doing something else, you know, whatever the case is, and you're not actively doing something, then you can be actively doing one of those things to help out. Or even say, you know, like in our ED, we have a lot of IVs put up in triage by our medics. So a lot of times I'll get students, we call them medic shifts because they'll go with Flassie, who's the name of one of our people who can put a dang IV in a stone. And so we send them out there with him and he's like, you know, been putting IVs in since, I don't know, 1910, who knows? But, you know, we do little things like that. And that is not a problem. I will tell you that people, I've never had a problem with a medical student doing too much of those types of things in the ED, like helping blanket, this, that, the other. Learning how to put a Foley in is actually really valuable. Because let me tell you, when I was a resident, I was called up to a code on a floor, and then I was walking by the next room, which I wish I could just transport down to the ED so I didn't have to walk by any rooms. But they're coming to get me because I'm the doctor in the hospital, and nobody else can get an IV in. And it's like, I guarantee you that everyone here has more experience putting IVs in, you know? So getting experience on those things is actually really, really important. How I think that students who are termed like overly aggressive is one term that I've heard, is when you don't have personal body space or you're not reading your cues. And if you've gotten feedback in the past of maybe having awkward interactions or communication hasn't been the, you know, best, then I would ask, you know, you probably are going to have a senior, like the way we do it is you are assigned to an attending, like you would be assigned with me, my shift, but there's a senior resident there. That's like your kind of you get to phone a friend whenever you want, and they're there to support you. I would go to either the attending if you feel, you know, good about it, or that resident and say like, hey, you know, can you give me feedback? I want to make sure I'm like giving you guys enough room to do what you need to do, but I'm involved enough. And that is appreciated. Like that is absolutely okay to say and ask. So if you have any question, and I'll also tell you, as you rotate and see hospitals, like if you, I trained in Philadelphia, so there's like 5 residencies at that time when I trained or 4 in Philadelphia. And it's like, some of them are very academic. I say academic, but, you know, standoffish and not, you know, it's just a totally different vibe than some of the county programs where we're kind of like armpit deep in bodily fluids and we're going to support each other and get it done type thing. And it's just a very different environment. So you also have to be aware that there's different environments. So asking someone if you're giving everyone enough room to do their work is kind of a good way to get feedback that way. Does that answer your question?
Yeah, no, it does. Great. Like it very well. Thank you.
Anybody else have any questions?
Hi, I have a quick question.
Yeah.
So I feel like there was a lot of great resources mentioned, and I definitely jotted those down. But of all of the resources, I want to make sure I like master one at a time and make sure, you know, I use it to the fullest. Which book or website would you recommend starting with? And is there one that's kind of most impressive to you in the past that they know about?
So here's what I would do. I would, each section, like the pre-rotation preparation, write down all of those resources, go check out the resources. This one, when I say read the first 3 books, that's going to be like 30 minutes of your time, maybe, right? It's not going to be that big of a deal. ALEM is going to be, they'll tell you 8 hours, it's 4 weeks. So like 8 times 4, whatever that is. And you can look at the individual courses that they offer. So like I said, you could skip EKGs, for example. That's what we've been doing. And then the Wikipedia, that's like a rabbit hole that I could spend 3 years of my life trying to memorize and learn. I get it. So you have to start with this self-awareness and figure out where you need to start with. I will tell you that if you're totally new to the game and starting out, figuring it out, I would rather have a structured, okay, ALEM has a structured curriculum. I am going to go down, because those are smart people who are clerkship directors who put that together. So they really know. When I said look at Wikipedia, I really want you to have like, I want you to either get like a index card or half sheet of paper, and I want you to make your own quick reference on abdominal pain. And only if that works for you. For me, I cannot read or do questions and just know it. That's not me. I have to have 25 colors, like look at my thing. I have to have 25 colors of different types of markers, and I have to color code it so I can stay awake, and because I probably should be on medication for ADHD, but I don't. And I have to process it. So you have to figure out your own way, but I want you to look at all those resources, look at them. And then that's why I'm saying build a plan. And if you don't have time to spend 10 hours a day for the next 2 months before your rotation, or how many ever months, which you don't plan that. Because you want a doable plan, and you don't have to know how to be a 3rd-year resident prior to arriving. But this is a way for you to not be dumbass Dr. Holly, who at the time like showed up like, hey, you know, you can have your resources.
Awesome. Thank you so much.
All right, Rachel, is there what is the best time to do an away rotation? Should we do it early in M4 or wait a few months closer? Okay. This is a very individual question, because if you only are allowed to do 1 rotation, that changes things. But if you can do 2 rotations, 1 home and 1 away, then you should do your home rotation first, and then you should do your away rotation after doing your home rotation. We're actually going to have another session on this, but I also would be happy if you want to DM our Instagram, our Medical Student Council Instagram, then I can individually talk to you to help you navigate that. There's a lot of students right now who don't have mentorships, EM specific mentorship, and I'd be happy to talk to you about your individual scenario. In general, you want to do your home rotation, which is supposed to be the people nurturing you and getting you ready for the big bad world out there, and do that early, and then do a second rotation by like have your letter by mid-October. That isn't always possible, and that's okay. You'll have a letter from your home and a letter from this other rotation. It's not the end of the world, but it would be ideal if that could be the scenario. I'm so glad whoever asked this, how to start making connections before our actual EM rotation. So if you're asking about making connections with people in the residency, you could definitely interact with their social media accounts. There's not a great way to necessarily start a relationship with any that I know of, like that would be applicable to all different clerkships. But as far as making connections before your EM rotation starts, we are trying to supply medical students in Florida with information on how to strategize and make connections. And our big event coming up is the Medical Student Forum at Symposium by the Sea. So every year, FCEP, the Florida College of Emergency Physicians, puts on a annual conference. It's free to student members. So if you've joined ACEP/EMRA/CORD/FCEP, which is all one membership, then you can come for free. And on the Saturday of the first weekend in August, it's always the first week in August, and it's somewhere in Florida. This year it's Coconut Point, Bonita Springs, and it's like Hyatt Coconut Point or something, but Bonita Springs. And we're going to have all of the program directors from all of the programs in Florida, or at least most of them. We're going to have some sessions specifically for students. We're going to have a skills lab for students as well. So this is a place. There's also opportunity for you to go to, like, there's the research forum. There's going to be all kinds of events. It is a very, very fun conference. A lot of the physicians in Florida, we bring our families. There's a volleyball tournament. It's a very nice, like, chill conference, but it's going to be an opportunity to meet other students, residents, and faculty from programs in Florida. So that is going to be a great opportunity to start making connections. And if you are following our Instagram, we are actually offering positions. You can apply for a position to help direct the skills lab and to be involved in the forum. So we're making that available. And then IMG friendliness of Florida EM programs. Are they friendly? Are they not? I will tell you that some programs are friendly, or friendly is kind of, you know, the colloquialism, but some programs interview and match IMGs, and then some programs have not. Because of the current state of the match and number of students interested in EM, more and more and more programs are considering and matching IMGs. So it is definitely a more favorable time for IMGs. And I personally do not have great advice for you to help you determine which programs are, unless you're looking at whom they have matched in the past. There is a very specific guide for students who are IMGs on the CORD website. So if you Google CORD student advising, you will be taken to a website that has a list of, you know, and they have special guidance for couples matching and non-traditional students and IMGs. So I would ask you to go look there, because that's going to give you much better advice than I will this moment. Anything else? I love the first question, preparation materials for rotation. I got you. We got that answered. Okay, anything else? We cover everything you wanted, Christina and Rachel.
I have a question, actually, and I don't know if this is pretty specific to FSU, so I'm glad I'm not the only FSU student here. I don't know how other schools do it. We have the opportunity to have like a elective, like they call it like a flex during third year before our clerkship. And other schools probably do this as well. Is there anything different that we should be prepared for if we are able to do that?
You mean
compared
rotate
to
at the
your-
very, very end of your third year and in EM
So
clerkship?
during our third year, we have like scattered like 2 rotations that are just flex. It's just supposed to be for fun to see, to experience other specialties if we want to. But for people that are interested in EM, you can request to do a rotation in EM before your clerkship, before your actual EM clerkship with the step or with the shelf exam and things like that.
So what is the question about that? Because it's,
So
It's
is
a great-
everything, is everything of what you said in this presentation also applicable to that? Is there anything, I don't know if you've interacted with students that have this?
so we actually, this year for the very first time, took a third year. We usually only take fourth years for rotations here, for example. And we only take them at the very end of the year. First of all, I would advise you personally to do it in the latter half of the year, because you have to have some clinical experience. I mean, you've got to like at least have done IM or surgery or something to have kind of the basics of how to approach people and got the history, taking skills down. Even though it's very different for EM, having that experience is important. I would tell you that I think it's great. And I've seen a few letters written from third year experiences, but usually only if they're May or June. And I would approach it as seriously, if possible, as your fourth year rotation, just so you can get those skills under your belt.
Cool, that answered it. Thank you.
All right, it's 7:03. Going to maybe stop the recording.
I also